Madam, please.
A very good afternoon to you all, and I should thank Saman sir, the chairpersons, for giving this opportunity to talk to you. So I'll be talking on importance of bedside teaching during residency. Already we have discussed so much about it, and sir has given why it is important. So I'll just start with the introduction. This was what William Osler said: "He who studies medicine without books sells an uncharted sea, but he who studies medicine without patient doesn't go to sea at all." So this is very apt. And how did this bedside teaching come into the forum? It was he is this Professor Osler. He was the one of the 4 founding professors of John Hopkins Hospital, and he is credited for giving the first residency program to bring medical students out of the lecture halls to the bedside for a intensive clinical training. So why this importance is there, and we say that it is dwindling, but actually bedside teaching is a part of the curriculum. Without that, very important, if you don't see the patient, if you don't examine the patient, and if you don't come in touch with the patient, even how much technology comes into being, we cannot come to a particular differential diagnosis. We don't learn certain abilities, and what is that all? Basic things of how to take a history taking, that is very important, the first and foremost. So when you enter a residency program, you should be first and foremost, that sir was talking, 3 months is rotated. So he has to learn the history taking, he has to learn the physical examinations. Examinations may be for ophthalmology, all the things like slit lamp examination, indirect, how to do a fundus examination, how to do it, tonometry, logical reasoning. If you see the patient, then what all things they are seeing, not just the eye, but the systemic things. So a patient who is coming, you are seeing certain pearls in that eye, go for and look for other things. You see a vasculitis in the patient, and then you have to see thoroughly whether he has any other foci of infection in the system. Think that can a chest x-ray be done, or can you put a stato on the patient yourself and to look for certain things. With that develops the clinical diagnosis. You learn how to make differential diagnosis, which is very important. And in the process, you learn a communication skills. That is how you talk to the patient. That is very important. And then slowly you learn what is professionalism. So when basically touch, respect, empathy, this which is very important, and it comes about. So in the process, it means to be a best doctor, which are actually being taught in the process, which we incur, which is not seen tangentially that we are teaching you. So that is what is very important. And then bedside teaching has all these important things which we have been talking about. So what we are talking, that technology is there with us, but this is very, very important. So if you see the routine rounds which they have in the medical college, morning rounds and evening rounds, why I am saying it is important? Because some of the subtle things, a patient who is having a fever and tomorrow you are going to take up for surgery, or a patient who is there with you with a foci of uveitis, it suddenly develops a joint pain, and you have missed it in the history taking, but in the evening rounds when you are doing a thorough examination, you come. You tell your own students that what are the things you are going to learn, you are teaching them the things. So not necessary, you can have your own plan of action that was being decided, but a bedside teaching or a round is very, very important. So how it will be done, the junior residents, the interns are with you, the senior resident gives a round, then you have allotted your assistant professor, and then grand round is done once in a week with the professors around teaching you all the basic things in the process. So it not only develops your clinical acuity and also what are your surgical complications, but also it helps you your reasonable thinking and how you manage the cases. So in a patient room, we ask certain things. I'm not going into details of this, and it actually helps you to develop your things. So what Jane Rao used to tell, and I remember that very much, in 3H he has taught us. So what are this? Your hands, your heart, and your head. So these things in the combination is what is basically a bedside or a clinical teaching, and which is very, very in the and has to be taken for any residency training to train them to be a professional doctors. Thank you.
Thank you very much. It's a very nice comment and observation. Very good. It should be every institution.
And basically, sir, the thing is, it's a system orientation, and if the head is good, they make their own protocol and pro forma, and then it has to be followed. So basically, it is not only the residents who at fault, neither the doctors at fault, neither the system is at fault, but who is there can make their own things, and then we go about. So whatever little resources also we have, we can make a very difference. It's your attitude that matters.
Very true, very true.
Thank you, Dr.